So your standard plastic surgery consultation, particularly cosmetic consultation, is going to be actually very similar to your consultation with your general practitioner or another doctor. There will be some differences with it, but the basic principles of it and how it will work will be very similar. The differences are going to be, firstly, it's often slightly longer than your standard consultations. The second difference, I think, is patients are often a lot more nervous than they are. The private patients and the cosmetic patients in particular are often more nervous than the ones I see on the National Health Service. And I think that's a function of the nature of the reason that they're there to see me. Very often people are coming about something they feel embarrassed or insecure about or somehow awkward about, and they have to open themselves up. And I think they can find it difficult. So actually, very often, the first part of the consultation is putting the patient at ease as best as I can. In addition to that, there's that kind of getting to know one another process. They're checking they're comfortable with me as much as I'm checking that I'm comfortable with them as a patient. There's a large component of the consultation that is expectation setting. So what I'm also trying to do is to make sure that the patient has an expectation, number one, that I can achieve, and number two, that they understand what I'm offering and that actually those expectations match one another. And that is tremendously important for cosmetic plastic surgery, because how you judge the outcome is not very clear. If you're doing appendectomies, outcomes are very clear. You're either dead or you're alive afterwards. It's binary. But for cosmetic surgery, it's not. One has a successful outcome if one is happy with it, and we tend to be happy when our expectations are met. So expectation setting is massively important. And as I say, the rest of the consultation is like your standard consultation with your doctor. So there'll be a discussion about why you're there, your general medical background, an examination, and following that, based on my experience, I would say my recommendation. So, how would a plastic surgeon assess the patient's candidacy? Okay, well, I think the first thing to say is this is a two-way street. As much as I would be assessing a patient's candidacy, they are going to be assessing the surgeon, whether they're comfortable with the surgeon to do the procedure. But to answer the question, I think that the most important thing, and I mentioned this before, is expectation. What I'm trying to understand is, what does the patient want? What do they think they're going to achieve from the surgery? And then trying to express to the patient what is achievable and checking that they match. So I think it's critical that I can match the patient's expectation. So the most important thing in terms of the patient's candidacy is we have matching expectations. There will also be a big element of trying to work out if we're just generally comfortable with one another. We have to develop a doctor-patient relationship. It's absolutely crucial. And a lot of that is very organic. And I will spend a long time with the patient just chatting, because I think it's important to check that we are both comfortable and at ease with one another and trust one another. So that's also vital during the consultation, something both sides will be subconsciously assessing. The other thing that is a bit more objective is the patient's general health. You just want to check that there's no reason that by doing what is usually a cosmetic procedure, that I would be placing someone at risk of life or limb because they have a significant medical problem otherwise. Because ultimately, my role is primarily as a doctor and secondarily as a cosmetic surgeon. We need to take care of the patient's well-being and general health first and foremost. The first thing I would want to know is, okay, I've come for this reason or that reason. What can you as the surgeon achieve? is my range of expectations something you can achieve? And I would want the surgeon to discuss that, but I also would like to see photographs and examples just so I can get an idea. And seeing the photographs and examples, you're never going to see something that's exactly the same as your situation, but it gives you a barometer of, generally speaking, whether you trust that surgeon's judgment, right? Like whether overall this surgeon gets the sort of results that I think are good results. I would also want to know something about longevity. One thing about a lot of the procedures we do in plastic surgery is they don't last forever. They have a certain lifespan, for want of a better expression. So you want to find out information about, okay, how long will this last? Will it last forever? The answer will almost certainly be no for pretty much all of that. And what do I need to be prepared for the future? You'd also want to know about the risks. Now, a lot of this actually the surgeon should be volunteering. If they didn't, I would certainly ask, and I would kind of wonder if they weren't volunteering this. But ultimately, every surgery, anything you do in life, from crossing the road to having a cosmetic operation, carries a risk, and you should know and be informed about that. And I suppose the final thing is what happens after surgery. What's the post-operative care? How long will I be, off for? When can I go back to exercise? But also, what happens if something doesn't work out? What if it's not quite right? What if there's some kind of issue? What are the contingency plans for that? So I think those are the sorts of questions that I would be asking. Second part of the question is, how do these questions help to ensure a positive surgical outcome? Well, look, the outcome, like I described before, is not something that is easily objectively measurable. It's not a binary, okay, my knee's no longer in pain compared to before surgery or whatever it happens to be. It is a case of whether you are happy with how you look after surgery and whether it meets your expectations. So I think the most important thing there is making sure that you and the surgeon are on the same hymn sheet with regard to what result that you're expecting. That's probably the most important thing. Okay, so this is a counterpart question to the previous question, right? Previously, you're asking how does the surgeon evaluate the patient's candidacy, and really what you're asking is how does the patient evaluate the surgeon? Now, that's a very good question. And the process can begin before you even attend the consultation. So firstly, you can check on the internet for the patient's credentials. So particularly the General Medical Council website has a registered list of all registered practitioners, but also can confirm that the surgeon in question is on the specialist register for their speciality. So I think that's a pretty important thing to check. Then there's membership of professional organizations. So in my case, BAPRAS, the British Association of Plastic, Reconstructive and Aesthetic Surgeons, and there are other ones for hand surgery and so forth. Now, membership of these organizations does not guarantee quality or that the surgeon, you will have a fantastic result every time. But these institutions have a vested interest in upholding their reputation. So it helps add to the weight of evidence that, okay, this is someone I can potentially rely on. Reviews, online reviews, everyone goes to online reviews, and information on the internet about that surgeon. And I think that's a pretty reasonable way to do it. You have to be mindful, though. It's entirely conceivable that you can get somebody who has great reviews and ratings. I'm very mindful that I'm aware that I'm on the internet and have reviews and ratings, but it might just be that they're very good at marketing. It doesn't necessarily mean that that individual surgeon, it's not a guarantee of quality, but it adds to the weight, as I say, along with memberships of organizations. And I guess the final way, and in a way, the most important way, is word of mouth. People that you know or who have had a good experience with that surgeon say, I had a good experience with that surgeon. I think in many ways that's possibly the best way to go about it, and a very, trustworthy way of going about it. We rely a lot on people, don't we, to give us that kind of information. And yeah, I would do it that way as well. Okay, and then there's an element during the consultation itself that you need to think about. So I think a red flag would be, I felt the surgeon wasn't listening. So I'm thinking, okay, if I was a patient, what would I be worried about when I turned up to the consultation? I think a disinterested surgeon who's not listening would be a problem. So I would check that actually they're understanding what I'm trying to say, what I'm trying to get across. And equally, that I understand what they're saying, that they're presenting things to me in a way that seems honest, truthful, and that I can comprehend. I think that would be very important. But I think the most important thing is that intuitive, organic feeling that I feel comfortable with this person. And that's something that we do every day with everyone. And actually, of course, as much as you're doing it with the surgeon, they will be doing it with you. So I would trust that probably above pretty much anything else.